even through the phone now.
Put it on speaker.
Yeah, put your phone on speaker. We're getting ready to go live on Facebook.
I can't hear you guys. Man, that's all.
Okay.
But you couldn't figure this out unless you was on here. You wouldn't have known it unless the video started, Zoom started. That's the when you can.
Okay, so we're live.
What does it say?
Select the speaker. Select the speaker.
Okay, good evening, everyone. We want to welcome you all to International Free and Accepted Modern Masons Incorporated and the Order Eastern Star. This is our Zoom conversation with the International Masons and Eastern Stars Supreme First Aid Responders and Nursing Department. And as you can see from the screen, we have our sister Michelle Reeves, who's an RN, registered nurse, and she is the Supreme Vice Director for the department. We have Sister Erica Duvall. She is the your Southeast National District, right?
I am, along with being the Supreme First Vice.
Supreme First Vice. And then we have Sister Michelle Stanfield, who's an RN, who's working on the front line of COVID-19. And we're excited to hear about that tonight. And she is Eastern National District, right?
Right, the Big East.
The director. The director.
Yeah.
We get this right. She is the director. And then we have illustrious Sam Williams, 33rd. He is one of the leading first aid responders in the department. And so we want to welcome all of you all tonight to Zoom. Thank you very much for participating.
Thank you.
Thank you.
Okay, with that being said, Sister Reeves, I'm turning it over to you, and I'm going to be quiet until I need to come on in the room.
Okay. All right. We're so excited to be with you on tonight to talk about COVID-19. Before I go any further, I want to give honor to God, to our illustrious President James O'Dogan, and also to the leader of our department, illustrious Frank Christmas, who has worked hard with us behind the scenes with this project to make sure that it goes well on tonight. One of the biggest things that we wanted to make sure as a department that we bring to you is why we're doing what we're doing, and that we are a resource here to help as we work together with the team to defeat this COVID-19. As Brother Evans is bringing the PowerPoint on, we're going to talk about the anatomy and physiology of the lungs. And we're also going to talk about why we're seeing the signs and symptoms and the high rate in the African-American community. The first thing we're going to talk about with the coronaviruses is that it is a huge family of viruses that started out in 2002 in Asia. It was totally eradicated in 2004, and then it popped its head back up again in 2012 in Saudi Arabia. So this is not the first time that the coronavirus has actually made its spell into the country. The next thing that we're going to talk about is the two areas in which the coronavirus has made its effect. If you look at the Middle East respiratory syndrome with MERS, this is where it was actually first seen in Saudi Arabia in 2012. And then in 2002, we see it pop its head also again with the SARS. And it presents itself either as a respiratory or a common cold. Okay, next slide. What is COVID-19? COVID, and you hear them always say it's the novel virus, meaning that this is a brand new virus that has been created. The coronavirus 2019 has popped its head and started in China, and it was found at a large seafood and animal market in China. Nobody knows how this virus was actually created. And that's the reason why we're seeing so much panic in the United States and other countries, because they do not know how it was created. So that's why it's critical that we continue with social distancing. How does the COVID spread? This is a droplet virus. And what does that mean? With the droplet virus, when somebody coughs, the large particles, they go up into the air and they drop at 3 feet. That is why it is so critical that we do the 6 feet distancing. Because if you stand approximately 6 feet away from an individual, it can help decrease your chance for exposure. When a person coughs and projects, it also could go in your nasal passages, your mouth, but one key area that we have not talked about is your eyes. These are all soft tissue mucus areas. So it is critical that we continue to practice social distancing. The droplet precautions are large. They can be as large as the size of a half of a dime. And when we talk about the lungs and the respiratory system, we're going to go more in depth with that. On this picture, this is a great diagram to show you. If you see person A is a person that has the coronavirus 19, COVID-19. This person coughs, that's standing within 3 feet of a person that's infected with COVID-19. Look at how many particles actually is going to hit that person, and look at the levels, the face, the arms, their clothing. But person C is actually standing 6 feet away. So that is the reason why it is so critical that we continue to practice social distancing. Now, I want to explain why we're seeing the signs and symptoms that we're seeing in the African American community. I want everybody to remember, if you ever had a child, when you first have a child, the first thing they do is they check the lungs. So we all get a healthy set of lungs when we first start out. It's just like the freeway. It's open, blood, oxygen is coming in and out. When we breathe in, we breathe air, oxygen into our nose. Once we breathe that air and oxygen into our nose, it goes then to our throat, our vocal cords, and down to our lungs. But there's two critical things that happen. When you breathe in, if you breathe in any particles or debris, it is stuck inside the hairs inside your nose. And that's the reason why we have hair in our nose, to capture any debris or particles. Once we continue to breathe down, and that actually goes down into your lungs, the mucus lining of your lungs create mucus, and it traps the debris. And either you're gonna cough it up or you're gonna swallow it. So now let's talk about a COVID patient. If you were exposed with COVID, somebody coughs on you, you're gonna inhale and breathe those large particles into your nose hair, is where it's gonna get trapped. Once it gets trapped into your nose hairs and you continue to breathe, it's gonna continue to go down your lungs. And this is why we're seeing the signs and symptoms that we're seeing. In the African American population, if you have hypertension and diabetes, your lungs have either expanded and gotten larger, or those arteries have gotten smaller and have contracted. And what happens is you're not able to cough up that sputum. You're not able to blow your nose or sneeze like you normally would, because the hypertension and then the diabetes have affected the structure of your organs. And that's why we're seeing so many African Americans that is dying from this disease because of hypertension and also from heart disease and diabetes. And why are we seeing this? Because of health disparities. We have a 45% literacy rate in the African American community. I work in healthcare every day, and I see people sign papers and don't even recognize what they're signing. So we're not being tested, and we're seeing people dying from this disease that's 31, 35, 40 years old, and everybody is saying, oh, they didn't have any underlying conditions. But guess what? They did. They probably had untreated hypertension. They probably had heart disease or diabetes and never knew that they had it. And this is the reason why we're seeing such a high death rate in the African American community, because we don't have resources. If you Google Publix.com, you can get free medications for diabetes and hypertension. All you have to do is get your physician to write an order for you. So then we see fever, cough, shortness of breath, and these symptoms appear within 2 to 14 days. So it's critical that we recognize these signs and that we get tested. And then what happens is, as these lungs and particles start to settle in your lungs and you're not able to cough and sneeze, it becomes a solid mass of mucus infected with coronavirus called pneumonia. And the right side of your lung is shorter. So you notice a lot of people say, oh, I have right-sided pneumonia. That's because the right side of your lung, the septum to lead to your lung is smaller. So it's easier for the mucus to go there and sit. Next slide. How can COVID-19 infections be prevented? One of the biggest things is hand washing. And Nurse Erica DeVoe would tell us the importance of hand washing.
Sister Duvall.
Good evening.
Good evening.
Hand washing is probably right now one of our biggest factors in controlling this. Washing your hands with warm water and soap is going to be one of the most effective things that we can do to prevent the contamination and the passing of this virus. Whenever possible, always wash your hands. 20 seconds, rinse it with warm water, use soap, liquid soap preferably, because it comes in a sterilized container as opposed to a bar soap. Using a bar soap, if you're sharing it with someone, the bacteria, anything that the previous person may have had has sat there, it's multiplied. But liquid soap comes in a sterilized container, so it's a little more effective and a little more safer. But we definitely want to make sure that whenever possible, we're washing our hands. 20 seconds, ABC song, whatever song you want to do, long as we're getting those 20 seconds, and that you're scrubbing with that.
So one of the things we heard was singing Twinkle, Twinkle, Little Star.
Yeah.
20-second song. And then I know we have Sing Happy Birthday 2 times. Now, is this the regular happy birthday or is this the Stevie Wonder version?
The regular version.
Okay. Okay.
You get a little more if you sing the Stevie Wonder version, but 20 seconds is really vital. But we should make sure that we are implementing that. Soap is just so important. It kills so many microbes that are out there. But if soap is not available, and I hate to say this, but so many people are going hand sanitizer, but soap and water is the most effective way. By all means, use hand sanitizer if you can't wash your hands immediately. But hand sanitizer, you have to have the minimum of 60% alcohol for it to be effective to kill any microbes. But so anything less than 60% is futile. So it's more important to use the soap and the water because it cleanses your hands and removes bacteria and viruses as opposed to the hand sanitizer. So just make sure that we're using it, we're utilizing it, we're not taking it lightly.
Now let me ask this question, Sister Duvall. When I was a child, my mama put a little bit of bleach in the hand washing detergent on the sink in the bathroom and in the kitchen. So would you advise people to put a little bit of bleach in their hand washing soap on the in the bathroom or kitchen, as long as they're not irritated?
Sure. Yes. And the thing that you have to watch with bleach and along with hand sanitizer, when you constantly use it, at some point, the effect of the alcohol and the strong chemicals can dry out your hands, which can cause your hands to chafe, crack.
Okay.
and it leaves a more open place for bacteria and things to get in and grow.
Okay, thank you.
So you really want to watch that, but in moderation, it's always good.
Okay. You finished?
I am.
Okay.
The next slide is, where have your hands been? I want everybody to pay close attention to this slide because our hands come in contact with so many different things during the day, during the recourse of the day. Sister Erica Duvall went over the importance of hand washing, but it's critical that every time our hand come in contact with a gas pump, keyboard, grocery buggy, money, elevator, that we are washing and sanitizing our hands. That is our biggest weapon and our biggest defense to be victorious in defeating COVID-19. The next thing that we're going to talk about is how can COVID-19 infection be prevented. Some of the most least inexpensive things that we can do is ensure that we are disinfecting our homes. And it is critical that we are disinfecting high touch, high traffic areas. Every hour you should be going in your home, wiping it down with Lysol wipes, a sanitizer, a disinfectant for high traffic areas that you're touching all the time. This organism can live up to 2 hours to 9 days at room temperature of 64 to 68 degrees. If a temperature gets above 85 or 86 degrees, it can live up to 28 days. So that is why it is critical that we are desanitizing and wiping these areas down, especially in high traffic areas, because it can live up in that environment.
If nobody's left the house, right, and we're still, everybody's the same folks are in the house, nobody's going outside the house, do we still have to keep cleaning and nobody's been exposed to COVID outside the house?
I would say yes, because we have a lot of people that are asymptomatic carriers that have not present any signs and symptoms, but they are a carrier. If you are in the house with somebody that has diabetes, if you're in the house with someone that have a history of cancer, their immune system is down. If they become sick or anything trigger their immune system to set off a response, they can get sick. So it's very critical that we treat everybody as they're infectious, even if we're not displaying signs and symptoms.
Okay, thank you.
Next, illustrious Sam Williams will talk to us about testing and give us some updates in the state of Florida.
Illustrious Williams.
Yes, good evening, everyone.
Good evening.
You hear me?
Yes, sir, loud and clear.
Okay, good. We on now. The topic is the priorities for the testing of patients with suspected of the COVID-19 infection. The symptoms, like Sister Michelle said, high fever, coughing, shortness of breath. The first priority that they're looking for is patients that are hospitalized with the symptoms. The healthcare facility workers are with the symptoms. The first responder with symptoms. Those are the first people that they want to test for the COVID-19, that they prefer to test first. The second group is patients with long-term care with symptoms. That's like people in the retirement home or rehabilitation center that's living there with ailments. And then patients who are 65 years or older with symptoms. Then the last one are patients with underlying conditions such as diabetes, high blood pressure, hypertension, all those things there with symptoms of the COVID-19. Those are the second group that they'll be testing. On the third group is any individual who do not meet any of the above criteria but has symptoms is subject to quarantine themselves for 2 to 14 days. If symptoms worsen, contact your primary doctor for further medical instructions. Okay, and here in Florida, I want to let you guys know in Florida, the state took over they designated the Hard Rock Stadium to administer the COVID-19 testing for those individuals with or without symptoms. To schedule an appointment, I have the number on here, the contact appointment line number. You have to call between 9 a.m. and 4 p.m. And the number is 305-499-8767. That's 305-499-8767.
Brother
You
William,
can call there to make an appointment.
what city is that?
That's Miami.
Okay, thank you.
Hard Rock Stadium in Miami. For any
Okay,
brothers
thank
and sisters in that area. Okay, and the other designated testing site is the Central Regional Park located in Broward County in Fort Lauderdale in the city of Lauderhill. And the address is 3700 Northwest 11th Place. And that's in Lauderhill, Florida, in which individuals with symptoms will need a prescription from their primary doctor in order to have the COVID-19 test administered. And any other questions concerning the COVID-19 testing, you may contact your local Department of Health and for further information in your area, your local Department of Health. They will be instructing on you, because other states, I don't know about the testing area there or where the locations are. So just call the Department of Health in your local area and they will instruct you on the testing area for it and the criteria for it, other than what I was just giving you.
Thank you. For those who are viewing, you can go to cdc.gov. At cdc.gov, click on the coronavirus icon or picture, and it will have a map throughout the United States. Click on your state map. That will lead you to your state health department, which should have the 800 number you can call, and then find out where you can go locally to take the test. And so that is at cdc.gov.
Illustrious,
Yes.
here in Nashville, Meharry University, the hospital is giving the test away for free. So if we have any African Americans here within the Nashville area who don't have insurance, if that's been a hindrance for them being tested, if they would contact Meharry, they can get tested for free.
Well, I know that the President of the United States and FEMA, as well as Congress, issued an order that everybody's tested for free. So nobody should be charged for testing anywhere. So any members, anybody who's watching this live stream who's being charged for testing, you want to call the CDC, or you want to go to cdc.gov, go to your state and check your health department, because testing for COVID-19 is supposed to be free and paid for through the stimulus package that was released by Congress.
Mm-hmm. Okay, before we go any further, Michelle Stanfield, the Eastern National District nurse, will be going over health proxy and how to don the face mask and gloves at this time.
Good evening, everyone.
Good evening.
I want to talk about your healthcare proxy and having a backup plan. You know, we have a lot of patients, family members, loved ones that require in-home care, have aides that come into their homes to take care of them. And oftentimes many of them have gotten sick and have been taken to the hospital. So it's very important to have your documents in place, have a copy sent to your insurance company, have a copy on file at home, and have a copy in your primary care physician's office. Because in case something happens and you do get sick and you are unable to make decisions for yourself, someone that you designate, someone that you trust will step in and represent you on your behalf, you know, honor your wishes. And I advise everyone to talk to their families. I know it's a hard subject to talk about sometimes, that you're going to be passing away, but it is part of life. And it's something that we should all have, a healthcare proxy, because you never know, you know, what's going to happen day to day. And if you need copies of those forms, you can always call your insurance company. They can provide you with healthcare proxies, your doctor's office. And if you need one, you can always email me, michellesanfield72@gmail.com. I can send you a copy. These are important forms to have. So many deaths are going on and you have a lot of people that's being unclaimed. People don't know who to call. Things are happening and this situation is real. So I'm encouraging you all to please update your paperwork, update your documents, your wills, your advance directives, healthcare proxies, power of attorney. Have all that set in place because a lot of people will not honor just someone saying, oh, well, she told me verbally. It can be a conflict of interest if you have families that, you know, are struggling and fighting to deal with COVID-19 or any other health issue for that matter. And I was also asked to show you how to put on a mask. This is my mask that I keep in a Ziploc bag because nowadays supplies are scarce, seem like. And you can reuse it, long as it's not
Ziploc bag.
a Ziploc bag, yes.
Oh, okay. That
I'll
is
tell you why.
okay.
Because you may have to reuse it.
Yes.
Because masks are expensive, certain masks anyway, like your N95s that I see a lot of people are wearing. And I ask that you all please save the N95s for your healthcare workers in the hospital. Save it for them.
We already had them in the house, in the office.
Well, if you have yours in the house, Brother Monty, I'm gonna tell you, go ahead and keep it. You know, it's yours, I understand.
Up mine and I already had it.
But if you want to donate it, you know, to a hospital that's in need, that would be wonderful. Okay. Now, mine is got little stretchies on the sides, blue on the front, white on the inside. The blue is the outside where this should be showing. Okay, so you want to take it and apply it around the ears, nice and snug. Pull it down, and then there's a wire that stretches across the bridge of your nose. If you can't understand me, I'll say it again. A wire that stretches across the bridge of your nose. You pull it down, and you give it a little pinch, so it's nice and snug, okay? And that's how you do it. Now, I still have my sanitizer here. And my sanitizer actually has 62% alcohol in it. So I'm making sure I'm using something good. When you're, like Sister Duvall has said, soap and water is best. That's your best defense. However, you can use the sanitizer, but with sanitizer, after the third use, you need to wash your hands with soap and water because after a while it gets gritty. So you need to wash your hands in soap and water, thoroughly washing with your hands pointing downward in the sink and let that water get the wrist and everything washes away from you, not coming back. Wash with your hands down. Then when you take those hands out,
you are good.
Out of the water.
To put the hands down in there.
Yes.
I think we have the best nursing department and the first aid responders in the universe. Because I'm thinking about putting my hands down in the water so that the water rolls down, right?
Yes, because you're washing away germs.
Okay, okay.
So if you're washing your hands with they're up, you're just sending it all up your arm and you're making a mess. So let's point our hands downward into the sink and wash good. Now, I did the happy birthday song. I did it for 20 seconds. And yes, I didn't like it. So I found me another song.
What is your song?
My song is We Have Come This Far by Faith. And that song actually is about 23 to 24 seconds long.
If you sing the Reverend Neil version, you're going to
I sing the one I know. You put your mask on. Like I said, you wash your hands prior to anything that you do, okay? You need to wash your hands if you go outside, you come back in the door, car handles, grocery shopping, take your coat off and go straight to your bathroom and wash your hands. That's a principal key. You need to wash your hands. Before putting on your gloves, don't just put on gloves thinking you're good. Putting on gloves is not preventing anything without washing your hands because you can put germs inside the gloves. Pull it out and you're carrying it everywhere.
Good.
I try. Now, so I don't wash my hands for the required amount of time, which is 20 seconds. Then I'm gonna take my gloves. Now I want you to remember, these gloves are not the best gloves. They rip easy, but they're doable. You wanna don your gloves. And I probably should have said after you wash your hands, have a towel already prepared to dry your hands. Because if you're out in the public, you want to use a napkin or a towel to turn it off if you're not using the faucets that are automatic or you don't have a foot pedal. Okay? And dry good. Now you can put your gloves on. You're good. You're ready to go. Now I want to take off my mask and I want to take off my gloves. I'm not touching my face with these dirty gloves on my hand. So we want to take our gloves off correctly and we want to dispose of them properly. So I'm going to ask you to take your glove in the center here, can you see? And then just kind of cuff it like that, lift it up. As I said, they rip easy.
Okay.
Keep it in one hand, okay? Then take your other finger up under the glove, lift over, cover, and you're good to go.
Okay. So,
Now,
real quick.
this don't belong on your couch. It don't belong on your countertop. It don't belong
In your pocket.
in your pocketbook, your pocket, because this is now contaminated. This is dirty. Dirty, 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 dirty. I gotta say it again. So I want you to take those extra few steps over to the garbage can. Open
Have
the
mercy.
huh? Say again.
Mercy. Lies everywhere.
And then whoop, into the garbage. Okay. Now for me, I'm probably going to be doing a little bit more because I will be in a hospital setting.
Right.
But now you're at home and you want to come out your mask. I'm going to ask you to come to the side of your ear, pull it out like that, and away from your face. Okay. Pull it away. Don't have it all dangling all up in here and everything.
Okay.
Away. Just pull it away.
I see Pookie and Shaquita. They put the mask down on their chin or put it on their forehead, and then they put it back down. And so,
Yeah.
what should we tell Pookie and Shaquita when about on that?
I'm going to say, long as you're protecting this inside,
Okay.
you're fine. Okay. Now, if you looked at mine, I'm just reusing it because I had makeup on and everything early and everything. This was my mask from yesterday, but I saved it for today. You just want to fold it, let the insides touch, okay? Because that's the part that you're protecting on your face, okay? That's the only parts that need to touch. You don't want the outside and anything else to touch that inside because that's got to go up against your face. Grab your Ziploc bag. Tuck it away nice. Now, you can reuse your mask. It's okay to reuse.
How many times?
You can use it several times, actually. However, if your mask becomes compromised within 30 minutes, meaning it's damp, it's soiled, me personally, I'm gonna get rid of it because if I start that sneezing business, it's a wrap. I don't want it no more. You know, I'm getting rid of it. But if your stores are limited, you don't have much, and you want to reuse it, use it again. But
So
after 30 minutes, that's gone.
Contamination from, let's say you worn the mask and somebody has sneezed or you're in an environment where COVID-19 may be on the outer part of the mask, right?
I'm going to ask you to use your best judgment.
Okay.
What you feel comfortable with. Because if you feel like, okay, Sister Michelle and I, we're about 3 feet apart from each other, right? We're wearing our masks. If you're going to be that close to someone, even if you're taking care of someone in your home, say you got someone that got sick, I don't care if they just have pneumonia or a common cold and you don't want to spread it or whatever, wear your mask because you're going to be about 3 feet in front of them, especially if you have a bedridden family member, somebody that you're taking care of. Wear your mask because if you're going outside and that person that's bedridden can't get out, you might bring them something. you know how we used to get up on top of people sometime when we talk, and every now and then people, a little something come out their mouth, that little spit, and it get that cheek, and you be like, oh, I'm sorry, they excuse me, and we ain't never gave no thought. Now I'm gonna look at you like,
Right. Like now they say we have to justify why we just sneezed and why we just coughed.
yeah, because I gotta know if I'm gonna tell you God bless you or
Right.
disease. You know, so what I'm saying is be wise. And like Sister Michelle said earlier, eye protection is good because your eyes are just like they say, your eyes are the window to your heart. Things can fly into your eyes as well. So if you wear glasses, like I wear reading glasses,
Okay.
things are not so quick to get in there. Now, I'm not telling you to go around looking like a Martian or astronaut or anything,
Right.
but be careful and be cautious. Now, the last thing I did not tell you, and I probably should have did it before I removed my mask, but I was getting hot. Wash your hands after you take your gloves off.
Okay.
Once you throw those gloves in the garbage, go back, pick your favorite song that you want to sing, Happy Birthday, the alphabet song, Twinkle Twinkle Little Star, or whatever church song you like, and get it in. Scrub good, scrub the palms of your hands, get into the hands like this, cover good, get that soap, lather good, rinse, as Sister Duvall said, in some nice warm soap water. Rinse, have your towel there, dry. Throw your paper towel away or hang your towel, whichever you're using, and you're good to go.
Couple of questions. Great presentation. Now, when you say right after you throw the gloves away, wash your hands, after you wash your hands, that's when you can take your mask off, right?
You really can. But then now you want to go wash your hands again because now you done touched the mask again.
Right.
You know what I'm saying? But if you remember what I said, I also kind of went on the side.
Right.
Pull that string.
What I'm saying is that after you wash your hands from taking off the gloves, you can go take off the mask, put it in the bag, and wash your hands again.
Well, for me, I'm in my own environment, so
Right.
I'm gonna go ahead and pull it off and then wash my hands.
Okay.
In the hospital, I'm gonna wash my hands again. Then I'm gonna go for my face because I'm just not taking nothing home at all.
So Sister Monique Walton says she loved the song that you said. What is it? Great is thy faithfulness?
No, we have come this far by faith.
Right. Okay. So we have come this far by faith. She says she loves that. She's going to use that song. So thank you. Sister Trellis Johnson out of Georgia says she loves the glove technique. And then Sister Quineldra Grimes says she also loves the information about the gloves. And so that's good. Also, Sister Ladina Moling commented that it very well put together, enjoying herself. And Sister Shivala Snell McFarland said, thanks for the information. She's had media overload, so needed info from trusted source. And it's good to see that our first aid responders and our nursing department is a trusted source. And as well as greetings, Sister Stanfield from the Big H Brother Dorsey from House of David 93 wanted me to, well, he put that shout out.
I just want to say one more thing about your sanitizer. Okay. You need to allow time for your hands to dry with that sanitizer. Okay. You can spray it. And if you got one like I do have more.
Okay.
Spray it pretty good. Don't just one dab and you done.
Right.
Get it in. Get it in.
Okay.
If you notice, I sprayed my hand real good.
Yes.
And it will dry. Alcohol dries pretty fast, but give it a little time. Don't just spray white and no. You need to apply some time. And then you'll know because it'll dry, won't be moist anymore. Everything will dissipate. I'll be happy. You'll be happy. You won't be coming to me talking about Sister Stanfield.
Right.
You know, I'm feeling some kind of way.
Right.
But I'm gonna also ask you to also remember it's not just fever, it's not just coughing, and it's not just shortness of breath.
What else?
You even experience any sore throat, abdominal pain, nausea, vomiting, loss of appetite. I want you on that phone calling your primary doctor.
Mhm.
or an urgent care doctor. Don't just show up at their office, but call and be advised.
Sister Stanfield, you and Sister Reeves are both active RNs, right?
You got it.
Okay, so you all are active in this pandemic that we're dealing with, right?
Yes.
I'm going in tonight to be very active.
So can you give us a first-hand view, you and Sister Reeves, a first-hand view? Take us with you on your shift, and what is that like in the hospital?
I just returned back to work on Friday, and I have lupus. And it's very scary because if I contract this disease, this coronavirus, I will only have a 10% survival rate. So it's very scary, but I took an oath to be a nurse. So I go in, I say a prayer. Today, I saw 30 patients, and we do a screen with them when they come into the office. We take their temperature and we bring them back and we assess them. Sometimes they do cough, sometimes they do sneeze or what have you, but you have to make sure that you use good infection control techniques. You have to make sure that you don't make the patient feel isolated. Also, when the patient comes in the office, we are giving them a mask and also gloves to put on once they come into the office. And then
personal protective equipment also.
yes, they are checked, their temperature is checked. They have to sit outside. We only allow one patient in the office at the time. So they are texted when we're ready for them to come in. The lobby is sanitized. It has to sit at a wet time for 5 to 10 minutes, depending on the cabicide wipe or what you're using. And then they're brought in. And then we rotate them out. So it's very scary. Sometimes when they call for grab at you or what have you, but you took an oath to be a nurse. And you have to go in every day knowing that you are called to do something that God has called you to do, and you have to provide them the best care. We have gotten phone calls from patients stating I'm on quarantine. I have been tested and I was negative, so I stayed home for 14 days. So it's very scary, but at the same time, it's a rewarding experience because you're able to help people through this pandemic.
Environment? Are you in a hospital setting? What environment?
No, I'm not in a hospital. So I'm actually in an office setting.
Okay, like a private doctor.
Yes.
Okay, Sister Stanfield, can you take us with you on tonight? Let's say last night. Give us a first-hand view of what's that like.
Well, let me start off by saying I've been out of the hospital setting for 11 months. I've been doing public health nursing.
Oh, wow.
Which is why I was just telling you those extra little atypical symptoms that you need to look out for and when to call the doctor. Last Friday, let's see, 2 weeks ago, I decided I was going to volunteer, go back in, get on the front line, because as Sister Reeves said, we took an oath, and I feel that is my purpose, is to help people. I care for people, and I talked to a lot of my colleagues in the New York City area, and my heart was breaking and I wanted to help. And I said, I can help on this end. I don't necessarily have to run into the fire, but it is here in my area as well. And I want to help. So Friday when I went in.
Tell people what area you're in.
I'm getting ready to tell you. I am actually going to be on the rule out COVID floor, or I may float over to the COVID floor. So Friday, I had to learn how to put on all the equipment, which is a PAPR, that they call PAPR. And it's the full mask. I'm gonna look like I'm part of NASA.
Okay.
And I'm gonna wear a HEPA filter. And I have to have assistance in donning it. And what I mean by donning it is putting it on. And I have to have assistance in taking it off. The process with even taking it off, before I can even take it off, we have to wipe everything off. About 2 to 3 minutes, I'm wiping the front. The nurse is behind me, wiping the back. Then we're gonna take off the equipment. She's gonna hand me new gloves before I even take off my headpiece. And then I'm gonna have to wipe it again. And then we're gonna have to clean the inside because at that point, it's a shared mask.
What city are you in?
I'm in Buffalo, New York.
Okay, Buffalo Trace. And they have a large African American.
Rough buck.
Right. They have a large African American population.
Yeah, it's pretty big. And as it was said earlier, you know, it's hitting our communities because of the different barriers that are here. You have those that don't like going to the doctors. Some can't afford health care. Some are just afraid to go to doctors and get help, you know, or they'll feel like they said, oh, well, my stomach hurt. As you heard me say, if you have abdominal pain, many people like, oh, I just got gas. I'll sit at home. You need to call your doctor. You need to let them know what's going on. You have, like I said, we have a lot of people in the community who have aides in the home, a CD pass aide or a PCA who come in the home. You don't know where everybody's gone. You don't know if they just came back from a vacation a couple of weeks ago, whatever. But then now all of a sudden you start experiencing these signs and symptoms. And a lot of times we'll ask you, have you come in contact with anyone in the last 14 days who's traveled outside the country? But I'm gonna even stretch that a little more. Now that we see that our states are sharing this virus now, I need to know if you've been traveling from state to state, because you know there are barriers now where you might not be permitted to leave New York,
right,
and go over to Detroit, Michigan.
Yeah.
You know, 'cause I had a trip recently, another trip, and it was canceled because they're not allowing us in.
I know Florida, last week we were talking with folks in Florida, and they were saying that they had the police barriers on I-95 and the 10, and were asking people if they had come from New York or had come from Louisiana. Those were two areas that they were not allowed in. Yeah. So, Sister Duval or Brother Williams, do you all work on the front line of this anywhere?
Yes, I do.
Where do you work?
I work at Port Everglades where the cruise ships come in at.
Okay.
And they had a big thing there with all the Princess Line and the dam boats that came in with people and crew members that was sick, and a few of them that was dead. They brought them out on stretchers.
Wow.
Yeah, but you know, I work out there, but I try and get work for distance away from it. And a lot of my coworkers tell me about it because you know, I'm up in the age and I have a lot of those underlying ailments, and
Okay.
I don't take a chance playing Russian roulette. You know, they paid us like for hazardous pay for it, but my health is worth more to me than money.
Right.
You know, I'm not like Sister Michelle Stafford and Sister Reed. I didn't take an oath for that. You know what I mean? I took an oath to pay my bills at home. You know, take care of my family. You know what I mean?
Okay.
But it was really interesting because every ship came in had some type of illness on it. It was like it was contaminated. Like the whole sea was contaminated because every cruise line, from the Princess Cruise Line, the Holland American, the Royal Caribbean, all of those boats, and the Carnival, all of them. And then what they're doing now, they're docking off the coast of Fort Lauderdale, off the coast of Port Everglades, and they're going out there scrubbing and cleaning the ship off, and they're bringing them in every 5 to 7 days to bring food in, load them up with food, fuel, and you know, take all the trash off of there and put it in the dumpsters and take it to the dumpster. So we're involved in that operation also because I'm a longshoreman there.
So there are people still on the cruise ships.
Yes, well, it's they had one ship out there last week, the Bean that they had people that was suspected of being sick. So they had them out there being tested and being, you know, in isolation for a while. Once they got clear of it, then they're gonna ship 2 to 14 days that they come out there, and they'll bring them back in here once they clear to let them off the ship. But Coast Guard would not let them come off on land if they had any symptoms, period. You know, and then some people threatened to jump off the ship and all this stuff. I mean, we had a lot of chaos going on. We had the Coast Guard come in. Man, I'm telling you, police, BSO, a few BSO officers have passed from it, from the COVID-19.
What is that? BSO?
Broward Sheriff's Department. I'm sorry, Broward Sheriff's Office. Okay. A couple of those have passed through the inmates, passing it on through the correction officer, one of the correction center, And also being out there on that Port Everglades and being in the area of a contaminated person, infected person.
Kick in on a couple of comments. So Sister Willette Martin was saying that this was very informative. Thank you for putting this together. And she wanted to know how can we get a copy of the literature that was presented. So for the presentation, what we'll do is if you go to internationalmasons.org/coronavirus.html, or you just go to internationalmasons.org, click on the coronavirus image at the top, and we'll upload this presentation. Also, I'm going to ask Sister Stanfield if you would provide us a copy of that healthcare proxy so we can put it on the website. So then you don't have to worry about individually responding to email.
Oh, thank you so much.
To the website. That's why we have the technology at our.
Yes, we do.
Kenyatta 659 says, Sister Hinton. She said great information. Sister Valerie Martin, Loving Princess 308 from Tampa. As I said, you can get a copy of the presentation on the website, internationalmasons.org. Sister Shirley Mullins says, great presentation. She's with the Guild Directors of Illinois.
All right. Oh.
Okay. And 1120 Sound, this one, Nampuki or Shaquita name. 1120 Sound says, great presentation, full of substance, awareness. Luscious Robert Stevens, Grand Master for the largest Grand Lodge in the order, says, International has the best, and he capitalized the best nurses and first aid responders. I know that I'm in good hands when I'm at a convention. Thanks for a good job, well done. Luscious Edward Walker, the Eastern National District Grand Master, says very informative. The Grand Matron for the state of North Carolina, Sister Latoya Caldwell, who loves calling everybody Bumblebee, is very informative. And Sister Monique Walton is telling me to stop it, but I don't know what she's telling me to stop. Sister Duval, what do you do? Are you in the healthcare profession?
I am in a laboratory.
Oh wow! Are you doing any COVID?
I'm dealing in right now. I'm dealing in science,
okay.
So I'm not on the front lines with any of that.
Okay. So you're not with testing anything related to COVID-19?
No.
Okay.
No.
Okay. Cool. So we're at 8:55. I want to thank you all for such a great presentation. You all amazing. I mean, amazing with the information that you brought to the members, especially at this time. I hope that we're not getting off. I'm not saying this so we can conclude, but I'm saying that as this progresses, that we want to make sure that hopefully we can call on the best first aid responders and nurses department on this side of the planet to update us on any new information as it's evolving, because we know that the numbers, are you all, Sister Reeves or Sister Stanfield, do you all look at the whole numbers, or do you just look at the numbers relative to your area where you're providing services?
I actually sit on one of the advisory boards with the CDC for healthcare disparities, and we look at numbers based on counties. We also look at where we're starting to see the curve starting to flatten. We're looking at the death rates, and we're correlating that with the new infections that we're seeing across. And then on the last call that we had on April the 10th, one thing that we're looking at is the number of new cases. And again, in the African American community is where we're seeing this virus run rampant. And
now,
if I could say,
Americans health disparities in Georgia or across the country?
Across the board, we're looking at the numbers in Louisiana, Detroit, the numbers are very high. Alabama, the numbers are starting to go up. So it is critical with the healthcare disparities with African Americans that when our loved ones are going to the doctor, that someone is going with them, that someone is helping them with the paperwork. And also with the nursing department, we'll be providing links of free resources that's available for people to get medication for high blood pressure and also for hypertension. There is also an after hours call if you work in a healthcare facility in different states, and I'll send that information to you where you can get PPE after hours. So there's a lot of information available, but I cannot stress to you enough, please keep your doctor's appointments. If you do not have health insurance at this time, Medicaid will be approved for you as we continue to go through this pandemic. Publix have a medication-free program that's set up, and one of the big ones is hypertension and diabetic medication. So those are key areas.
So we had a question that come through. I think you or Sister Stanfield can take this. Sister Dorothy Stewart says, if I have a compromised immune system, how do I safely go to the store and do other things?
What we're seeing in Georgia, and I'll let Michelle or Eric or Sam chime in as well. In the state of Georgia, we are really stressing that people that have a compromised immune system, we have a lot of senior high-rise centers here in Georgia, especially in the county that I live in. They have been told that they can't come out of their apartments. We have different social organizations that will go and pick food up for them, prescriptions for them. They have a lot of different resources that's available with the Senior Citizen Advocacy Cooperation. So after the call, if I could get her information, I'll be able to help get some resources set up. If you have to go out and you're immune compromised, what Michelle Stanfield went over today is critical and vital, that you're putting the mask on correctly, that you're wearing your gloves. And then they also have special hours allotted for seniors to go in where you're not around a lot of people. So I would say pick times where it's not a peak time where there's a lot of people in the grocery stores, and then reach out to the senior citizen agencies or any other resources.
So Stanfield, you want to chime in on that?
I just want to jump in a little bit. My background is oncology, okay? And for anybody that has an immunocompromised system, I'm going to advise you to wear your gloves, wear your mask, as if you do when you go to your appointments. A lot of patients come in with masks on because they're defending themselves against you, and I'm doing the same thing against protecting myself against you, and you against me. It's a reverse effect, okay? And if you do, I'm not going to tell you to reuse your mask. I'm going to tell you dispose of it, because you do not want to compromise yourself. And the way things are now, unless you're critical, they're not keeping you in the hospital. COVID-19 has flu-like symptoms in the beginning. So if you're not presented with a fever or something more severe, and you're like right now I'm sitting, and if all of a sudden now I develop difficulty breathing, I can't get my air and I'm struggling, that's a 911 call. They're going to take me right away, and they're probably going to keep me. But if I'm just a person with COPD and I know that I struggle with breathing on a regular basis, that's not emergent enough to stay. But in your case, please put your gloves on,
Just
hand washing.
What is COPD?
Oh, I'm sorry. Oh,
No, you didn't.
chronic pulmonary obstructive disorder.
Okay.
Okay, I'm sorry. I have habits.
It's okay. I'll jump in and ask, because some of us, we're not in that acronym world in the
Right.
Yeah,
And I have to try and remind myself, I have to say things more like 1, 2, 3, A, B, C, because she would understand me. The panel would may understand me, but you might not understand me. So I'm gonna just suggest that, yes, throw away your mask, throw away your gloves, and good hand washing, and just practice that social distancing, staying 3 feet apart, 6 feet apart from others, because that's your best defense.
That was
I know they're saying,
that was a little shady what you just said, like everybody on the panel except me.
well, I have to use you as an example. I want people to understand, if
Wait a minute.
XYZ understand me now. Oh, don't just start with me. Don't just start. I done seen how you did the Supreme Grand Major, and I'll just watch her and take her lead.
Okay, so let me chime in. There was another question that came in, but I wanted to let you all know that Sister Lisa Sweeney said great information. She's proud to be on the front line. She's also an RN in New York.
Yes, she is. She's one of my nurses in the Big East.
Okay. Supreme Secretary of Education for STAR says, great presentation. You all in my prayers. Illustrious Frank Christmas says, excellent presentation, makes me proud. And so he just said you all have made him proud. Illustrious Daryl Dancy of Pennsylvania has asked this question. What are some of the medicines we can buy over the counter?
For the COVID-19, actually, if you have mild signs and symptoms, they're going to actually send you home. Do not take ibuprofen because it actually irritates the disease. You can take Tylenol and push fluids. Now, they do have some medications that are out on the market, and one of them I take every day, Plaquenil. That is one of the drugs that President Trump is trying to push through the FDA. That is a treatment for this disease. But again, these are prescription-based medications, but there's actually not a over-the-counter drug other than just taking Tylenol, pushing fluid, and then they also are talking about meds as an antibiotic, but again, that's prescribed.
Yeah, from what I'm understanding, what I've been telling all of my members that I deal with on a regular basis, stock up on Tylenol, stock up on your cold medicines that you use, like if when you got the flu or the cold, you know what brand works for you. Buy Gatorade, you know, so you can replenish the vitamins that you may lose, you know, if you become dehydrated. And then monitor your appetite, you know, maybe eat soup for a little bit, you know, don't rush it, you know.
So Luscious John Dogan, our Supreme Deputy Grand Master, says first aid responders and nurses have done an excellent job of explaining safe practices for the membership and their families. 1120 sound, that's one of them Pookie Shaquita things. Give some thumbs up, turn it blue. I don't know what that means.
Oh, don't turn blue, please.
Otis Meninci says, good evening, brothers and sisters. So we say good evening to him. Sister Evangeline Worthy says, are there any vitamins you all can help us with to help our immune system? Suggestions for vitamins.
Yeah. Vitamin C. Take your multi-day vitamins. You know, I do.
Pure vitamin C crystal and vitamin B.
I've been taking emergency that and boosts my immune system. I'm not playing. I heat it up and drink it like it's tea.
Okay. Sister, Brother Williams, is your wife saying something in the background?
No, I was trying to say something, but I was letting the sister talk.
Okay, okay.
No, I take vitamin C crystal every morning, along with omega, and you know other vitamins, complete vitamins also. And I take that on a daily basis because you know, like I told you, I'm out there on that front line, out there to the port, and it floats in the air. You know, so I have to protect myself and my body as well.
Okay.
But I would like to say this: don't just take vitamins just to be taking them. Consult your doctor.
Okay.
Because every vitamin is not going to work. If you take certain medicines, it might decrease the effect of other medications. So please get the advice of your doctor.
You are smart. You all are smart. I like it. This. You know what? We need you all more like to do. Do y'all do this at conventions and maybe we miss it or something? Or y'all have
never been.
I run and hide. I don't be out there like that, you know.
Evolve, she be sitting back there with all the mints and crackers, and I'm like, okay, well, you can tell me anything to help me out while you got these peanut butter crackers back here with these mints. I need more information than this. So you all have definitely done a great job.
Evans, I would like to say one thing.
Absolutely.
Not being in the hospital, but being in the private physician office, the front office coordinators, the CNAs, and the back office staff, they're on the front line of this as well. They may not be in the healthcare setting, but the front office coordinator, the back office, the CNAs, the PCTs, they're the ones gathering the information for the nurses, for the doctors, so that we could go in and make appropriate decisions regarding the patient's health care. So they also are on the front line. They play a critical role. They're the ones that tell us if a patient is illiterate that needs additional help. They're the ones gathering medication. So they play a critical role as we continue to go through this pandemic, especially in a physician office setting. We could not do our jobs without CNAs, nurses, or front office staff.
We definitely have to give homage to the healthcare frontline people, those who are behind the scenes. Even, you know I was watching one of the press conferences and President Trump was talking about even those who take out the trash everybody who's putting themselves at risk
Mhm.
contamination in one way or another. We have to remember them. And I know that in Georgia, and I don't know in Buffalo, New York, if there's a hospital there, or even in Nashville. I know Nashville got hit pretty big, but you know, I think Elmhurst, New York, say is kind of the epicenter or the center of it, as far as you know, the highest cases are in New York.
I know we have some high cases in my county, and my county is Erie. And
Okay.
right now we're pretty high. I did write that down too. But you know, again, we're high because I think it's basically because of the prevalence that's in the African Americans, if you can hear me. And then you have a lot of homeless. You have a lot of people that are suffering with behavioral health issues. And you also have, what's the word I'm looking for? Oh yeah, immigrants,
Okay.
people that are here. You know, I just received a call earlier today saying, oh, they're hiring at the detention center, the holding center where the immigrants are. So you got a lot of healthcare disparities
Yeah.
that's out there that needs to be looked at. And I just want to kick back. Someone asked about what they could do, you know, if they go out to protect themselves. I think it was the sister with the cancer.
Right. Yeah.
However, this would be a great opportunity for international, our sisters and brothers to pull together and help one another. If you know your sister has a compromising illness, call her up, call him up and say, hey, do you need some groceries?
Okay.
I'll come pick it up. You order it, we can order it, or put the list outside in your mailbox. Put it in an envelope. We'll put on some gloves and we'll grab it or whatever, you know, to protect you. That's a great way to help someone, you know, because there are people that need assistance. I was following up on the news and people were trying to get groceries to be delivered and they're paying extra tips, $50 tips just to get people to deliver, you know. So, I mean,
Give me that address where they giving the $50 tips.
I need that job too. I'll be out there. I'll be like, here you go. Here you go. But I'm just saying, you know, those are things that we need to consider. I've been trying here on my end in my chapter, because I have a lot of sisters that are in my chapter that are up in age, you know, and I give them calls and I let them know, if you need anything, let me know, you know.
Maybe we'll present a challenge out to the members to help one another throughout. And
It's called loving one another.
Sister Cortez Maria Lewis says, great evening, IFAMM. She said vitamin C get lots of sun and also get some rest. Sister Lisa Sweeney also inserted multivitamin and zinc.
Yes, zinc.
Yeah.
And don't we get, what do we get from the sun? Is that vitamin D?
Vitamin D.
Okay.
Yes.
Then also 1120 Sound. I wish they tell us their name. 1120 Sound. I'm gonna say Pookie Ray Ray. Says thumbs blue is a term meaning support. Also rate the YouTube channel under the video. Okay. And coronavirus cases as of Wednesday night, there are 1,345 confirmed cases of COVID-19 in Erie County. Is that where you also Stanfield?
I am in Erie County. My numbers are, what was your numbers?
No, this person, 1120 Sound, says there are 1,345 confirmed cases of COVID-19 in Erie County. And
well, I have 1,624 confirmed.
Okay, so
we've gone up.
Yeah, depending on where they got. Oh, so this is Brother Dorsey. That's 1120 Sound. Now,
Brother Dorsey, just sit down and wait for me to call you up and
Ray Ray, sit down till you know how to change that screen name from 1120 Sound to something Brother Dorsey, because I'm gonna a little Ray Ray till we get that right.
But however, I do want to say this: people are recovering. Everybody is not going to see the Lord at this time. Some have, you know, and we want to keep them in our prayers, the families that have lost, but some people are recovering, you know. Like in my county, there's been 479 recoveries. Okay, so it is happening, just slow. It's just slow. But
somebody just sent a question to you, Sister Stanfield, specifically about the face mask. They say the face mask taking off and putting it in a Ziploc bag, is that spreading the germs inside the bag?
Well,
serious question, because they texted to me and I know this person Yeah.
I'm gonna say you're putting it in, but you got to remember the white part, the part that's going on your face is clean. Okay, it's protected. If you fold it like I showed you, yes, you're gonna put germs inside that bag because the outside is out there. But however, you're gonna open it and put the part that's not touching the bag on your face.
Okay.
Now, me, when I go in tonight, I'm gonna look like a bandit
Okay.
because I have this nice big hair bandana,
Okay.
and I'm gonna pull it up over my face, and I'm gonna put my mask on because I just gotta protect me. Now that's me, and I tell my daughter to do the same thing because she's at the same hospital. She's a CNA,
Oh wow. Okay.
and she does it. And they have gotten so creative with it. And the children, they wear masks. They make masks. I mean, people have been very creative since COVID-19 has come. They even have where instead of, because sometimes the masks get a little weak, the bands get weak. So now they wear these little caps with buttons on the side and hook them to the buttons. So
Really?
their mask can stay up on their head, on their face rather.
Seeing those.
I seen it Friday. I thought it was like the most wonderful invention ever. I was like, great. Because a person that's wearing these masks for hours on end, you're gonna have to be concerned about breakdown behind your ear, because it can create pressure. So I was like, I like it. So whoever makes them, I'm looking to get one.
Well, let's get some last minute remarks to folks. We've been on the call 70 minutes now. We try to stick it around hour and 15 minutes. And so let's get some last minute thoughts from you all before we conclude. We'll go with illustrious Sam Williams, as he was the last one to get here. And he had so many challenges. We're going to make sure we get him in before he have any more challenges before this call ends.
Well, I appreciate the information that we're getting. It's very helpful. I hope they take it serious, because this nation wasn't ready for this disease, this virus that came around. And as a whole, we're still not ready. We're not prepared. I wish that we could have did it like I was talking to Sister Michelle Reeves earlier. We could have did this back in February and got on top of things and got people informed. It probably would have saved a lot more lives. And like I'm sorry to hear about the sister that passed and her son in New York. I give my condolences to them, but and the family. But it's just everybody's like slow motion. They're not taking it seriously, and they're not doing anything to protect themselves until it finally hits home or get close to home. And that's what lets them know that, hey, I got to start doing something. Some of them is too late. Some of them is at, at the hospital trying to recover, isolation or, quarantine or whatever reason it is. I'm glad that we got a hold of it now and we're giving our information, informative information that people can use and people can benefit from it in the future.
Thank you. Sister Duval.
I want to say I miss my IFAMM family, and this too shall pass. If everybody does their part, take it to heart, and put your best foot forward, utilize the best practices, and I think we can come out of this even stronger as a nation.
Mm-hmm.
Sister Stanfield.
I'm gonna just advise you all to stay prayerful. Don't be afraid, but use the wisdom that God gave you. He gave us all wisdom. Follow the guidelines of the CDC and the WHO. Follow your doctor's advice, your nurse's advice, and practice these guidelines faithfully because it will help save your life. Don't take it for granted because life is short, and if you get an opportunity to tell your loved ones, because now we can't get to them as easily, tell them your loved ones and tell them next time you get together, they're going to get your spread on and everything and enjoy one another. Enjoy them.
Sister Michelle Reeves, our Supreme Vice Director.
I would just like to thank our Supreme nurses and first aid responders. They have done a phenomenal job. We came and put this together because we wanted international family, the IFAMM family, to know that we're here that we're a valuable resource and that we're going to get through this together. It is critical that we all pull together and take this information back to our members so that we can help stop the spread. My thing that I would say to everybody is love one another. This is critical as members in the organization, that we call each other, that we're checking on our members, that we're finding creative ways that we can help each other so that we can stop the spread, and that this too shall pass, because it's in the scripture and we have to go back to our Lord and Savior Jesus Christ. And my people who will call by my name will just turn away from their wicked ways, then he will heal the land. So he's left us the instructions to this process that we have. All we have to do is follow the instructions. And God has allowed our organization to have nurses and first aid responders. I don't care what credentials you have behind your name, you are a first aid responder. And we're here to help. And we are spread out throughout the organization. And we're here and we're going to fight this together. We're going to be victorious. And when we get back to the next convention, we're going to give everybody a big hug, because I miss everybody. We love you. And I would dare not close this out without thanking our Supreme President, Illustrious Dogan, and also our leader of our department, who trusted us, gave us the guidance and the resource, Illustrious Frank Christmas, to do this presentation. And to all the members that came on tonight, we're here and we love you.
Thank you all. And so Sister Reeves, I just wanted to do a slight correction because you did a remix on that scripture. So I wanted to bring it on back to the original version before you do the remix. Is that
I was in the English Standard Version.
Okay, because you forgot to humble themselves and pray.
Amen.
People will call by my name, humble themselves and pray.
Amen.
Then God will heal the land.
Amen.
And so, Sister, our Supreme Secretary of Education for STAR, Sister Michelle Slayton Williams, said she just lost a family member in Detroit just hours ago. So we want to send her some love. And then GAWAA lost their cousin on the 9th, which was only 4 days ago. Their mom's nephew at the age of 49 to this virus. He lived in Florida. And so we want to send our hearts and love to those members and their families, as well as Sister Julia Castle Ali said a great presentation to each first responder, faith over fear. Sister Trellis Johnson said, great job. Stay inside, stay safe, and trust God. And Sister Lisa Sweeney says, just remember, social distance saves lives. I also want to highlight, Brother Williams, I don't know if you've seen this, but it looks like when you're an Eastern Star, you get a lot of awards and plaques, because I'm looking on the back of Sister Reed's wall and Sister Duval wall, and I see 2 statues, trophies, and I don't know how many plaques. And Sister Duval, I see you starred up behind you. And so we brothers, we got to get it together, because all I got is Malcolm, Martin, Obama, and Mandela and Marley. And so I'm gonna work on hanging some stuff.
No, I have my room there. I have my blue room for it.
Well, next time you get on, you better put this
in that blue room.
Yeah, because these sisters, they lighten it up on this.
Yeah, I see that. I see that.
I also want to let everybody know tomorrow night, the Southeast National District Grand Master, Grand Matron, as well as Florida's Grand Master and Grand Matron will be featured. We're going to be covering the Southeast National District on tomorrow night at 8:00 p.m. And then next Tuesday, save the date, we'll be going to the Gulf Coast. And don't worry, Sister Stanfield, brace yourself. We're going to come to the Big East. We're going to make our way around.
I know y'all got to come to the Big East. Wow. We the Big East, baby.
That being said, may God bless International Free and Accepted Modern Masons Incorporated and Order Eastern Star, our Supreme President, illustrious James O. Dogan, our First Lady, Sister Minnie Dogan, and all our Supreme Leaders, National District Grand Officers, local leaders, and most importantly, our members. May you all be blessed well and have a good night. Thank you for joining us.
All right. Good night, everyone.